And this is Rich from Rich TV Live, your late night vampire. And today I received a situation. I'm going to read to you guys what it says. Coronavirus disease 2019 COVID-19 situation report 45. This was reported by the World Health Organization today. 5 new countries, territories, areas: Bosnia and Herzegovina of COVID-19, or otherwise known as coronavirus, in the past 24 hours. In anticipation of an increase in the number of COVID-19 cases, the Southeast Asia region is preparing to roll out rapid response activities by engaging with communities, procuring personal protective equipment, PPE, and ensuring laboratories have the capacity to test for COVID-19 or ship samples to global referral laboratories. The situation in numbers total and new cases in the last 24 hours. Globally, 95,333 confirmed cases, 2,241 new. In China, 80,565 confirmed cases, 143 new. In China, 3,015 deaths, 31 new. Outside of China, 14,768 confirmed cases, 2,098 new outside of China. Outside of China, 85 countries. I predicted 100. We are now in 85 countries and territories outside of China. And 5 of those are new, which I just read to you guys, those 5. And 267 deaths, 53 new outside of China. The WHO risk assessment in China is very high. Regional level is very high, and global level is very high. All 3 are very high. This is directly from the World Health Organization. I am registered with the World Health Organization, so I do get all of their media, their information that they're willing to roll out to the media. I will be receiving, and I will be reporting for you guys. I've been reporting this for 6 weeks now. And since I've been reporting this, everything just gets worse. It just gets worse, and it gets worse, and it gets worse, and it gets worse. The WHO Director General emphasized the importance of implementing a comprehensive approach to mitigate the impact of COVID-19. Educating the population, expanding surveillance, caring for patients, and strengthening preparedness systems are key to interrupting transmission. The WHO Director General's remarks can be found. WHO's initiative, called the WHO Network for Information, EPI-WIN, has identified trusted sources and engaged with those trust chains. And it has a list of all the regions that are heavily infected, and it's pretty much all over Asia now and Europe and a little bit in North America and South America, Australia. So much information on this. Got so much information directly from the World Health Organization. It's pretty intense. Breaks down all the areas where the deaths have come from, the cities, confirmed cases, deaths in each city. You know, the thing that's really becoming disturbing to me is the amount of people that are dying outside of China. I think that's concerning because I feel like the number that's dying outside of China is just really growing, and nobody's really talking about it, but, like, someone should talk about it, so let's talk about it. Um, are you guys concerned now at this point? Because these numbers just continue to get worse. 98,000 cases, 421. 98,421 coronavirus cases worldwide, 132 recovered. I mean, crazy. It's now officially in 89 countries. I predicted it would be in 100. We're almost there. It's only been 6 weeks. China has reported 3,042 deaths. South Korea has reported 40 deaths. Italy has reported 148 deaths. That was alarming for me. 148 deaths. Iran has 108 deaths. Iran has 3,513 cases. Italy has 3,858 cases. Like, Italy has 351 people in serious or critical condition. The outbreak in Italy is really bad. And that's right in the middle of a whole bunch of countries in Europe, including Portugal, where I'm from, my family's from. And they're not far from there. And France has got a lot of cases, and Germany now has a lot of cases, and Spain has a lot of cases, and USA now has 226 cases, including 12 deaths in the United States. 8 in serious condition in the United States. So maybe they're slowing it down in China, maybe. But are they slowing 46 cases now in Canada, including one person in serious or critical condition. And when this started, I did predict that there would be deaths in Canada and the United States. And how would people react then? And you can see that people are now loading up food. They're loading up their supplies. They're getting water. They're getting food. How you guys doing? It's your late night vampire. Please smash the like button. I appreciate you guys being here. Um, Hope you're having a great evening. This coronavirus has become very, very serious. It's affecting the markets. It's affecting everything, and we're just living in a different world right now. So I never imagined in 2020 that I'd be talking in March about coronavirus stocks, but that's the world that we're in. And I never thought I'd be talking about a coronavirus that is spreading in multiple countries all over the world, spreading right now in Europe, in Italy, spreading in Iran, spreading in South Korea, and spreading in China. And now people are talking about going back to work in China. And I'm like, well, what's going to happen then? It's going to spread again? I mean, how do you stop this? Where does it end? Steven says, Sup, Rich. Appreciate what you do, man. Hey, man, appreciate you guys. Thank you guys. Thank you guys for the likes. Thank you guys for joining me. I am receiving information from the World Health Organization, and I'm just reporting it to you guys, what I'm getting from the World Health Organization. And it's breaking down all the confirmed cases. The Republic of Korea has 5,766 cases, 438 total confirmed new cases, 35 total deaths, 3 total new deaths. It breaks down like if it's local transmission or they're imported cases. They have a lot of information here. The thing that's alarming is Italy, 3,089 cases, 587 total confirmed new cases in one day, 107 deaths, 27 total new deaths in Italy. Like, those numbers are pretty staggering. Like, they jump out off the page. Like, there's other countries with a lot too, but they seem to have a lot. They're jumping off the page. Then Iran, 2,922 cases, 586 um, new cases overnight, and then 92 deaths. So, I mean, these numbers are pretty big in certain areas, and these are other regions outside of China now. So, this has effectively spread now to other countries where it is now breaking out in Iran, in South Korea, and in China. So, it has effectively now spread to multiple countries. It's not just an issue in China, it is now an issue in South Korea, Italy, and Iran. Those 3 countries, I feel like, have the worst of it right now other than China. But South Korea is catching up to China. Like, South Korea has 6,000 total cases, and China has 80,000 total cases. So South Korea seems to be catching up, and Italy has 3,800 cases. Iran has 3,500 cases. Then we got Germany behind them with 545 cases. This is not a list you want to be on. Then we got France at 423 cases. Then we have Japan at 364 cases. Then we have top 9 countries in the world. America is now in the top 9 countries in the world with the most cases. What do you guys think about that? Brownie777 says, I live in Vegas and we had our first confirmed COVID case today. Does it bother you? Are you doing anything different? Is it changing the way you live? Are you scared for your life? Are you scared for your family? Or is it just like another cold, like everybody else is saying? Is it just another flu? Thank you guys for the likes. I appreciate you guys being here with your late night vampire, your boy Rich from Rich TV Live. I'm humbled that you guys are going to join me this time late at night. A little bit of a different atmosphere, a little less stress. The market's not open right now, not for stocks, anyways. And I wanted to talk about coronavirus because I'm getting these statistics from the World Health Organization. The Amazing Life of Dixie the Border Collie says Washington State 10 dead. Now docs may refuse to test people not at risk. So they're going to spread it all over and it will be pandemic. It's a pandemic. I've been saying that since it started. Frank says here in the States, over 2 million people in Washington State were just asked to stay home and work and not venture out by the government. Wow, that's crazy. Like, out of a move, there is nothing they can do. That's scary. That's brutal. The Amazing Life says, wow, you guys are putting a lot of messages. Catch up here. Whoa. I don't know about the mask thing, man. You guys have a lot of messages. I'm trying to catch up to your guys' messages. And I'm like, wait, I'm like, what just happened? Okay, here we go. The Amazing Life says, I live in Washington State and I canceled all appointments and bought a bunch of supplies. Smart. Better be safe than sorry. Worst case scenario, you got a bunch of supplies. Yo, what's up, Reefer? They're going to stop testing people with no underlying health conditions here in Washington, and they are just spreading it all over our state. Oh my goodness. That's crazy. Cheryl Clark says in Maryland, Montgomery County, right outside of Washington, D.C., they have some cases of coronavirus from 3 people that are quarantined in their house. Many nervous politicians in Washington, D.C. Yeah, I'd be nervous. I mean, everywhere. I mean, it's already touched 89 countries, right? 3 cases confirmed in Maryland, 10 out, 39 in Washington. The numbers are just growing exponentially. It's very, very concerning. Anthony Alvarez says we are starting to get concerned here in New York City. I think we all should be, safe and protect ourselves and protect our families as much as we can and do whatever we can to protect them. Yeah, Washington is a hotbed. That's brutal. Boris asks, so what should you put your money in, Rich? Gold, thinking of abandoning my cannabis, or at least some of it. I think gold is a very smart buy. Gold and Bitcoin. I've been saying that for a while now. I think coronavirus stocks are going to do very well right now because they don't have a cure. So there's going to be an opportunity there. There's going to be an opportunity in gold and gold stocks. And I think there'll be an opportunity in Bitcoin. I think there'll be an opportunity in Forex. And if you guys would like to join the academy, I'd love to work with you guys. I'd love to teach you guys how to build financial freedom through trading and through building and teaching others how to trade. Um, we have a huge community, and I would love to trade with all of you guys and build with you guys and travel with you guys and have fun and make money. Steven says, I'm holding my MJ, buying gold and Bitcoin. Smart. Smart. Gold and Bitcoin are two assets that are going to go up. David Dickerson says 25% mortality rate in Washington state. Where do you get those numbers? 25%. The Amazing Life says there are millions walking around with it undetected, untested, and spreading. That's what's happening, right? That's why it's now in 89 countries. Like I said, it would be. They should have canceled all. So a 3.4% case fatality rate for 1 million deaths to occur. The number of infected should be around 35 million. Earth population is 7,000 million. So unless weather kills it, we are doomed. I think we'll find a cure. John Hughes says it's getting worse. Well, it'll continue to get worse until we find a cure, right? The Amazing Life says 10 here in Washington alone. I think there's going to be more than everybody thinks everywhere. Rich, did you buy LMTCF? LMTCF. LMTCF. I'm not even looking at the stock markets right now. I'm kind of thinking about more like about the coronavirus. Let me get into this. I want to get to your guys' messages, but I want to read you guys this. Oh, because it's really good information here. I'm going to bring you right from the World Health Organization because I am representing the media now, accredited media representative from the World Health Organization. They send me information because I'm accredited media, and I get this information sent to me directly now. So I feel pretty special that I'm able to share this with you guys. They have like really good information that they're sending me. Here it is. Strategic objectives. Whose strategic objectives for this response are to interrupt human to human transmission, including reducing secondary infections among close contacts and healthcare workers, preventing transmission amplification events, and preventing further international spread. That's number one. Number two, isolate, identify, and care for patients early, including providing optimized care for infected patients, diagnostics, therapeutics, and vaccines. 5, communicate critical risk and event information to all communities and counter misinformation. 6, minimize social and economic impact through multi-sectoral partnerships. This is directly from the World Health Organization, guys. This is their goal. I'd like to help them. I'd like to stop this. I'd like to find a way for us to learn to live with this without having everybody get it and spreading this vaccine. This can be achieved through a combination of public health measures, such as rapid identification, diagnosis, and management of the cases, identification and follow up of the contacts, infection prevention and control in healthcare settings, implementation of health measures for travelers, awareness raising in the population, and risk communication. So they're telling us exactly what can be done to reduce the spread of this. Now, ready for this? I'm breaking this down, Charlie Brown. Get ready. Preparedness and response. To view all technical guidance documents regarding COVID-19, please go to this webpage. Who is working closely with International Air Transport Association, IATA, and have jointly developed a guidance document to provide advice to cabin crew and airport workers based on country queries, and the guidance can be found on the IATA webpage. I mean, I cannot even imagine what it would be like being in the travel business. Who has been in regular and direct contact with member states where cases have been reported? Who is also informing other countries about the situation and providing support as requested? Who has developed interim guidance for laboratory diagnosis? Advice on the use of masks during home care and in healthcare settings in the context of the novel coronavirus outbreak. Who is working with its network of researchers and other experts to coordinate global work on surveillance, mathematical modeling, diagnostics, and virology, clinical care and treatment, infection prevention and control, and risk communication. Who has issued interim guidance for countries which are updated regularly? Who has prepared a disease commodity package that includes an essential list of biomedical equipment, medicines, and supplies necessary to care for patients with 2019 NCOV. Recommendations and advice for the public. If you're not in an area where COVID-19 is spreading, or have not traveled from an area where COVID-19 is spreading, or have not been in contact with an infected patient, your risk of infection is low. It is understandable that you may feel anxious about the outbreak. Get the facts from reliable sources to help you accurately determine your risks so that you can take reasonable precautions. Seek guidance from WHO, your healthcare provider, your national public health authority, or your employer for accurate information on COVID-19 and where COVID-19 is circulating where you live. It is important that you be informed and guidance issued by national and local health authorities. For most people, COVID-19 infection will cause mild illness. However, it may make some people very ill, and in some people, it may be fatal. Older people and those with pre existing medical conditions, such as cardiovascular disease, suspect case, a shortness of breath, and or other etiology, and fully explains the clinical presentations at a history of travel to or residence in a country area or territory reporting local transmission of COVID 19 disease during the 14 prior days to symptom onset. That's suspect A. Suspect B, a patient with any acutes prior to onset of symptoms. Or C, a patient with severe acute respiratory infection, fever, and at least one sign symptom of respiratory disease. Example, coughing, shortness of breath, and requiring hospitalization and with no other etiology that fully explains the clinical presentation. Probable case, a suspect case for whom testing for COVID-19 is inconclusive. Inconclusive being the result of the test reported by the laboratory. Confirmed case, a person with laboratory confirmation of COVID 19 infection, irrespective of clinical signs and symptoms. It's directly from the World Health Organization website. Reefer Aljoin says Bitcoin should be in a rally, but it's not. Makes no sense. Well, it's been going up a little bit. You guys are talking about LMTCF? Talk to me. It's the late night vampire. Sona. Yeah, you guys are talking about Sona. Sona had a monster day today. Sona had a monster day today. And they're doing test kits with General Electric. So I think it could go higher. Yes, I did buy Sona. Angel says, I live in Chicago. Fifth person has been detected. I'm going to buy a mask. I don't know if a mask's going to help. Dylan Fraser says, first case in Alberta tonight assumed. Yeah, I think it's going to be everywhere, guys. You're in Alberta? What's up in Alberta, man? How you guys doing? John Hughes says, nothing will save you. JT says, look at the total cases chart. Daily cases started going down as China was containing it. But now as it is spreading globally, daily cases are going back up again. Yeah, because instead of it being in one spot, now it's in like 5 spots spreading. It's crazy. Cheryl Clark says, attention, Jamie Dimon of JP Morgan Chase just had quick emergency heart surgery, they're saying. I hope hope he'll be okay. Gail says shelves are emptying in Michigan. Is it really like that? Because it's not like that here in Canada. Anthony Alvarez says LMTCF is definitely going to go up once people hear about it. Yeah, I mean, they got to deal with General Electric, right? And they're doing test kits, and I know we're running out of test kits, so I think it makes sense. But guys, remember, Rich TV Live is strictly for education, entertainment purposes. Always do your own due diligence. Always do your own research before you invest in anything that we talk about on our show. Always talk to a financial advisor, okay, before you invest in anything that we talk on our show, because the entire market right now is very risky, a lot of volatility, and there's not a lot of guarantees in this market because everything is overpriced. Some things are underpriced, and the market's not trading on real fundamentals. It's trading on just pure hype. So nobody knows where anything's going to go. It's crazy. And I mean, I'm talking about even the biggest analysts are just like throwing their hands up. They're like, who the hell knows? We're up 1,000 points on Monday, down 1,000, down, Tuesday, up 1,000 points Wednesday, down almost 1,000 points Thursday. I mean, we're probably going to go up tomorrow, but we've been down for 7 red days in a row. A 7 out of, was it 7 out of 8? I think it's like 7 out of 8 weeks in a row we've been in the red on a Friday. And if we get red this Friday, I think that'll be one of the biggest red Friday streaks in like years. Kyle says, I bought puts on Trip, SDC, lockup March 10th, one cruise line, one airline. Yeah, I think that's a smart move. Cruises and airlines are big trouble. The Amazing Life says, it will never end. It will be a pandemic. I believe is here to stay. It's very possible. John Hughes says, our boy Rich, the best reporter. Hey, thank you, John. I appreciate you, brother. Dylan Fraser says, Costco in Calgary sold 4 to 5 pallets of toilet paper in 90 minutes. Oh my God. Max says, The Amazing Life says, and it mutated. Now there are 2 strains of it. Yeah, I mean, this is where it gets really crazy. Gail says sanitizer, Lysol, paper towel, toilet paper wipes. Virgo King says, I'm on lockdown at home. I got a couple ounces of weed so I can stay in for a while. How long is that going to last you? Month? AMZ says, death's going to soar. HHS said only has 1% of supplies needed for full-blown pandemic. Yeah, we're not ready. We're not ready. Ruben says, hi from the Philippines. How you doing, Ruben? Thank you for being here. If you haven't smashed the like button, please smash the like button when you join. Subscribe so you can get up-to-date news from your late night vampire, your boy Rich from Rich TV Live. Follow us everywhere. If you would like to learn how to trade stocks and buy gold and buy Bitcoin and take advantage of momentum in the markets, trend reversals, price action in Forex, and everything else, you guys, how you guys can do what I'm doing, which is have fun and make money, man. Live the dream. Be us. You can do it too. Reefer Aljoint says, first dog to human case in States. Dog to human? How did that happen? Three cases. Ruben says it's a bioweapon created by the China government. Yeah, a lot of people believe that. I don't know, man. I don't know. It's crazy to think that they would put it out on their own people like that. But you never know. I don't know. I'm not a conspiracy theorist. I like to listen to theories, but I'm not an expert and I don't know. AMZ says dozens of medications in the US are on danger list of going low in 45 days since China is closed. Yeah, I think China's opening up again, though. China's opening up everything again. Ruben says Bill Gates is behind this. What makes you say that? Vu Dang, thank you for being a member of the Rich TV Live community on YouTube. Vu says, hope by April the vaccine shows progress. I hope so too. I know that I know is working on it, and I know that GILD is working on it. So Gilead Sciences and Inovio Pharmaceuticals. So stay tuned. I'll be on top of it every single day. I know you guys will be too. So that's what makes this the greatest community in the world right here. And thank you guys for the likes. I really appreciate it. Helps us go more viral so people can join the conversation, join the chat. Dad says my COVID stocks will rise. Yeah, I got a bunch. I sold IBIO today. Very happy about that. Day traded that twice now. So I'm just going in and out, in and out, in and out, take my money and run. And I suggest you guys do the same. These markets are very volatile. Take your money and run and stay in cash. Cash is king. At any point in time, we could have a crash or a dip. That's a great time to buy the best and try to hold the best stocks with the majority of your portfolio, and then play with maybe 10 or 20% of your portfolio with more risky plays, coronavirus plays, cannabis stocks. But I would be buying like Visa, MasterCard, American Express, Facebook, um, Microsoft, Amazon, Google, the best companies, Netflix, Apple, those are the best in the world, and just own those and then play around with, a portion of your portfolio, but build your portfolio with the best. AMZ says Apple co-founder was patient zero in Washington. Really? Kevin Holmes says because of the type of markets. Max says China is hiding the numbers or panic will set in and China is finished. Yeah, I mean, a lot of people are saying that. Nobody knows. Looks like the numbers are going down in China. So I mean, I don't know how that works, but without a cure. So I don't know. I honestly don't know. Virgo King says, bro, if this is a Chinese bioweapon, then this will warrant a nuclear strike against Beijing and Wuhan. Three-piece with the soda says, just wash your hands, Rich. Yeah, that's what Trump said. Just wash your hands. Wash your hands, people. But even the World Health Organization said, you got to wash your hands. Sam Medeiros says, cure will come from Israel. It's very possible. Kevin Holmes says, is there a patent on the virus? Someone is capitalizing. There is a patent, I heard. Hey Tree says, well, Rich TV Live, if I stop going live, then you know there's a problem. Anthony Alvarez says, Rich, how many cases in Vancouver? Vancouver. Vancouver too. I heard 20. Alexander Carpenter says, we need more videos like this. Hey man, I try to bring you guys what I can when I can. You know what I mean? Boris says, I have a course. He calls GLTA. Don't buy options unless you know what you are buying. Anthony Alvarez says, New York City just in 24 hours. Well, New York City is a huge, huge, huge city. So you expect the numbers are going to grow, unfortunately. Alexander Carpenter says food prices is rising. And that's the trends in China that we're dealing with this. When I spoke to them, said that the prices of food in China are rising. So this is going to be an issue load because they're doing test kits with General Electric. No, I haven't bought a mask. I don't really think a mask is going to help. Joe Mama says, have you seen the Wuhan handshake done with your feet? Looks like an old school kid and play dance move. No, I haven't seen that yet, but I heard about it. Alexander Carpenter says, this feels like The Walking Dead. It just doesn't feel right, right? Like, what kind of world are we living in right now? Steven says, we thinking green or red, guys. What's the roller coaster going to do? Community thoughts. I'm thinking it might be green, but if it's red, it will be 8 out of 9 weeks in a row, I believe, where it's been red on a Friday. The Amazing Life of Dixie says, Flyby is the first corporate casualty of the coronavirus. Flyby? I don't even know what Flyby is. Sonny Robinson says, Trump doing the same thing, ignoring. LH halted, got approved for human trials from Pentagon. LH? All right. Let me write that down. All right. We're getting into picks. Guys are getting into picks. Late night picks with the late night vampire. Yo, I know you guys are for real. You guys are serious when you get into late night picks. Late night picks. LH. LH. I'll look into LH. Late night picks with the late night vampire, man. You guys are serious. Brent's like, I like my VITQ. Yeah, I mean, it's looking good, bro. Sonny Robinson says it's getting bad in New York City now. Yeah, I think it's going to get bad everywhere, unfortunately. I really do. D. Walty says spring break is coming soon. Lots of travelers. I know. I'm really worried about that. Michelle Clark says, I have absolutely no respect for the WHO. Why? Sonny Robinson says it's spreading on trains now in New York. Oh man, that's just scary. Anthony Alvarez says, gotta wear a mask on a New York City subway. I think the only thing that can help you is a hazmat suit. Boss says more rate cuts coming 100%. Brian says, I urge everyone to listen to CYDY conference call from tonight. Only ones with a drug ready to go soon as FDA approves. CYDY. All right. CYDY. CYDY. We're doing some late night stocks. You guys want to do some late night stock talk? CYDY. That's the crazy thing about the late night vampire. We could just flip the script. We can go from coronavirus to stocks. So CYDY is at a dollar two. Yeah, looks interesting. It's been as high as $1.65.